I'm very soft-spoken, so let me know if this is too loud or too too quiet. Yeah, I'm Sue Holstrom. I've been involved with this group probably for a little over a year, and I'm kind of back because we're kind of fine-tuning our assessment, and just basically are just going to reintroduce it since we've got a lot of new members, and just to kind of go, it's always good to go over a little bit of basic neuropathy review anyway. I work for a company called Excelicare. I primarily work with patients who have peripheral neuropathy related to an autoimmune disorder. So I go into the home and I give IVIG and treat people who are more kind of homebound. And part of that is I do an assessment, a neuro assessment, and our company has a program. And what we've tried to do is we've tried to incorporate some of that program into these support groups. So we're now in all 3 support groups here in Austin and Georgetown here, and I just want to share some of that with you and then have you kind of participate. So I'll kind of go over a little bit. We've got the... Oh, do I need to use the mouse to change?
Oh, yeah, just the arrow.
Okay, because the arrow's not...
Yeah.
Oh, it did work. Oh, it's not changing on here. Okay, that's what's confused me. It wasn't changing on there. Okay, go over just a basic review of the just neuropathy symptoms, the benefits of doing a self-assessment, and tools that we're going to use to do some self-assessment, and then we're all going to kind of break up and do kind of work on a self-assessment form and questionnaire and surveys, which you'll all get a handout for.
And you have a handout of her presentation.
Yes, you have a handout of the slides here, so you can kind of, if you can't read the screen or because the lighting's a little not quite right.
I think you've handed them all out. If you're with
Are we-
somebody and can look on, I think you've gone out, which is a good problem to have.
I know we just went around the room, and actually we have probably a very good representation of the causes of neuropathy in this room, which is kind of helps my slide in explaining it. But 1/3 of all of neuropathy cases. Oh, thank you. I'm afraid to step on that cord because I'm afraid I would trip. I don't have neuropathy, but I'm a fall risk. So 1/3 of all neuropathy cases are related to diabetes or prediabetes or glucose intolerance. And it's just, a lot of it's related to the fact of how long your nerves were exposed to sugar. And so I think someone mentioned here that they didn't know what caused it, and then 10 years later they were diagnosed with diabetes. And this is true to this case. And then the next third are known causes, and a lot of you mentioned a lot of these cases: autoimmune, infection, hereditary, surgical issues, compression, toxins, vitamin deficiencies, underactive thyroid, compression trauma, tumor, carpal tunnel. There's actually over 100 known cases. This is just a small sample of a list of what can cause neuropathy. And when you go to your doctor and they run the gamut of blood tests, it's just a matter of trying to rule out all these. And when they do all those tests and they can't find anything, it's called idiopathic, which we kind of explain things to you, is where we just don't know what the cause is. We don't know if, and it's something too we may find out later. And this is a number that I really hope over the next 10 years to really decrease, where we kind of can figure out what the cause is with new genetic testing, with new medical tests, just because I think this is so frustrating, because not only do you have something, this neuropathy, but you don't know what caused it, which is hard because you don't know then how to correct it or what the right treatment is. So just to kind of briefly define neuropathy, so you have your central nervous system up here, which is your brain and your spinal cord, and then you have your peripheral nervous system, which are the branches off of those two. And and yes, it doesn't mean just the arms or the legs. It can mean the blood pressure. It can be, there's your heart rate. There's just, and I'll go over the separate things in a second here with your peripheral nerves. So there's the autonomic division and the somatic division. The autonomic division is more of things you can't control, and this is more of things that you have control over. So the first, just want to go over 3 types of nerves that you have. You've got your motor nerves, which kind of go from your spinal cord to the muscle, and it's just a communication between those. I actually have do we still have that little model? We had it over there on the table, and it kind of gives you, and it's kind of like a display of this, the whole, the myelin sheath and the nerve and how it kind of connects to one part to another, to how your nerves kind of interact between one another. The second type of peripheral nerves is a sensory, and this is where some of you mentioned the large fiber and the small fiber. The small fiber are the pain and the temperature, whereas the large fiber convey vibration, position, and balance. And there's obviously different testing that they do to assess between those. And then there's the whole separate, the autonomic nervous system, which this controls your heart rate, your digestion. This is more of your breathing rate, your kidney function, your liver, whether or not you have bowel or bladder control. So everyone within this group, just to say you have peripheral neuropathy, there's so many branches off of that. And so, your doctor will diagnose you, whether you have a motor, a sensory, what kind of large fiber, small fiber. A lot of it, if you don't know or if you're not seeing a neurologist, these are questions that are good to kind of know and to ask your physician to kind of get clarification of these. But a motor neuropathy, you can have the crampness in your legs. You can have some muscle losses. You can have some ankle reflexes, loss of that, and it can even cause changes in your skin and your hair. The sensory neuropathy is more of vibration, touching, limb position, temperature, and your pain, whether you're hypo or hypersensitive to things. Some people can go around and step on things and not even know it. And then there's others that will step on just a small breadcrumb and the pain will come shooting up their leg. So it's just, there's different variations in that. And I love this little slide. Nancy gave this to me of your feet, and just the panic that goes through it if they only had a face. The autonomic neuropathy, you can have problems, like I said, with digestion. You can have your breathing, your respiratory rate. And these are things, like I said, these are things that they're involuntary. You can't control them. You can have impaired breathing, difficulty swallowing, inability to sweat, loss of bowel or bladder function. I've kind of gone over those 3, but you can actually have a combination of a couple different ones too, which that can make the treatment even more difficult too, when you don't have just one of these, when you've got a crossover between them. So this is more of why I'm here, is to kind of help explain to you why we measure and monitor your health and your progress. I work for a company, like I said, Excelicare, and so what I do is I go into the home and I give them their treatment, but one of the main things that I do is I go in and I do some physical assessments with them. I do some surveys, I do some questionnaires, and what our company does is it kind of puts it all into this big fancy report and graph, and then the physicians get them. And it's great for the physicians to be able to track their patients and how they're doing without having to necessarily see them every 3 to 6 months. Because like I said, many of my patients are homebound and it's very difficult for them to get to the office. So when I go and I can assess and give them a report, it not only saves everybody time, but money and inconveniences too. So that one thing that, we kind of found was very helpful. But on a side note, for when we started this with our company about 4 years ago, is that we found it very beneficial to use for insurance companies to pay for the medication that I give. The medication I give is about $15,000 to $25,000 a dose. And so as you can imagine, insurance companies do not want to pay for that. And so what we've been able to do is we've been able to track these patients and assess them and kind of more or less provide more of an objective data that proves that the medication's effective, which makes the insurance companies feel like, okay, it's worth paying for, versus just going into the doctor and saying, I'm feeling better. So we've kind of used that to for a lot of benefits that it necessarily wasn't developed for. But, it's important to know, for you guys to know if your treatments are working. You can go in and you can be diagnosed and they can tell you what's wrong with you. They can do a bunch of tests. A lot of times it's trial and error with medication. Some things work, some things don't, and then we go on to phase 2, or we start something and then it stops working. So, to be able to know and have everything kind of written down and assessed is important to know where your trends. And it overall, I've been doing this for about 3 years, and it's really helped improve quality of life. And we've been able to detect small changes. For me, in my job, I've been able to when someone starts to have balance issues, I'm able to call the doctor, and we're able to lower their dose or lower their frequency because obviously the medication's getting a little too potent for them. Or we've, actually made them come in for a visit and they needed some more evaluation done. And what we're going to do is we're going to go over these questionnaires, and I'll explain that in a minute. But, this is meant to, we're going to keep the data here, or you're welcome to take it with you to show your doctor, because it kind of gives them a really good glance at where you are and what you're doing and how what direction you're headed. And this thing is kind of our big headline. We want to know who's in charge of your health care, and we hope it's you and not your doctor, because you need to be in charge of what's going on. You need to make sure that what they're providing direction for, you're capable of following, and you're just not walking in and out of the office with no clue what's going to happen next. There's a couple studies that were going to be, that Nancy has kind of pulled up. The more involved you are with your healthcare, the better you get. This is from AARP. And then another study observed that those with higher activation levels were more active in partnership building with clinicians and displaying competence in directing their treatment. So, I think the benefits of monitoring and measuring your progress they're out there, and the more data we get, I think the better everyone is going to be with the healthcare. I think just the direction that I've seen healthcare, I've been a nurse now for 25 years, and it's kind of gone from letting your doctor manage everything to really learning how to manage it yourself. And that's not an easy thing to do. It's not easy for me as a nurse to monitor my own health and to keep track of all the records, or to keep track of my kids' immunizations, or my kids when they were sick and when they got better. And when you have a chronic illness, it's something that you definitely you need to monitor, because the doctors aren't doing it these days. They don't have time. So what we're going to do is we're going to do a couple questionnaires, which I think, have you handed out the packets? Or okay, so we have a packet, and it's got a couple It's got a couple questionnaires in it, which I'll show you in a minute. And then we're going to do 2 physical tests. Now, those that have been with this group have known we've always done a walking test and a grip strength test. And we are no longer going to be doing the grip strength test because Dr. Hussein has another idea that thinks will be a little bit more effective for the group. And so as soon as I'm trained on that, I will do that. But it's with a tuning fork, which just apparently came in the mail. And it kind of checks vibration. So this is something we're going to be introducing hopefully in the next month or two with the group. It's got like a little sensor on here, and we can check vibration and how long it takes before you stop feeling something. And he thinks that this is more effective than the grip strength. So, but for those of you that we never did the grip strength with, it's not quite as critically important. And then the other test we're going to introduce is the balance test, where you're going to cross your arm and you're going to stand on one leg. And I obviously can't stand for more than a second, but we'll just time you and see how long you are. And that just kind of tests your weakness. Or
What's the get up and go?
and the get up and go. I'll explain that in a minute. Yeah, I actually have this more in a slide for each one of these. So this is one of the first forms you'll fill out. This is a patient self-assessment of your neuropathy symptoms. And I know several of you have already filled this form out, but we're actually going to have you fill it out again because it's part of the point of this is to kind of monitor your progress and to see, okay, if you filled this out 6 months ago, where are you today? Is your pain level the same? Is it still like in your ankle area, or has it moved up to your knee? Or is it in your wrist and now it's moving towards your elbow? It's kind of a tool that we use to kind of assess where your neuropathy is and where it's going. And for you too to kind of describe what it is. We also have some stuff on here to list your medications. A lot of times we're on something and we just, I mean, I've gone to the doctor and I blank out. I'm like, what was I taking? What did I take that didn't work? And to try to rethink of what you took is real difficult. So we just have you list that here, and it's just a kind of a reminder. And maybe some treatments that you've tried before, who you see. Do you see a neurologist, a podiatrist, just your primary care physician? We ask you just to rate your pain, just so again, over time we can tell whether or not it's changing or if it's getting better or getting worse. Then there's a new assessment we're introducing where it's called the ONLS function assessment. It's something I use in my job to assess my patients. And it's kind of like, do you have difficulty with walking? Do you have trouble with turning a lock and a key? Do you have trouble buttoning or zippering? And we kind of will add up the points to this and keep track of your point level and see where you're headed again. If you're getting better, if you're getting worse. And then there's another survey that it's a little bit more detailed, so I didn't put that up here, but it's a 13-item survey. It's licensed by Insignia Health. And what we're going to be doing is we're going to be having you fill that out. And the goal is to kind of get, it kind of identifies whether or not you're in charge of your health care, your confidence with your health care. And what we're going to be doing is we're going to be sending this into them unidentified with the results and try to get some ideas of what we can do to where this group is, what your needs are as members for different topics. Do you guys need help with, confidence in talking to your doctor? Do you need more nutritional assessment? It kind of will help guide us with what direction to go with the speakers. Along with you getting a report, I think they're going to be getting a report. You'll get an individual report too about how of a trend with your behaviors and. So there's two physical tests that we're going to do. One is a time get up and go test, and we have those set out in the hallway. So what you'll do is you'll kind of start from a sitting position, and you'll walk 3 meters, and that there's a blue line. You'll walk that, and then you'll walk back to the chair. And what we do is we time you. and to see just at your normal pace, because we don't want you running or rushing through it. And then we kind of score you. Now, if you're 10 seconds or under, that means that you're independent, you're pretty good at walking, your balance is usually pretty good. If you're between if you're between 11 and 20 seconds, you're more semi-independent. You may need the use of a cane or even a walker at that point. And then if you're greater than 21 seconds, you're usually dependent or have an assistive device, or you should be having an assistive device. A score of 14 seconds or more has been shown to increase a high risk of falls. So that alone is a real mark for me to kind of monitor where you're at. I know several people, we've had 30 people from this group over the last year and a half, and I've kind of noted trends. You know, some of them have been right on that border, and over the course of the year, some of them have improved and some of them have declined. So we kind of mark your score on a chart, and we just kind of watch where you go. And if you're going from 10 to 15 seconds, that's kind of an indication that you're not only at a little high risk of falls, but actually you're 25% more likely to fall and injure yourself than if you're under 14 seconds, according to the research. But it's just more of creating an awareness too, that, hey, I need to slow it down a little bit. I can't be rushing through things. You know, we don't want to have you rush through the test and trip and fall, because trust me, I would do that, and I don't have the neuropathy, as I said. And then this is the single leg test. I know he's got his arms here, but we're going to actually have you cross your arms and then put whatever leg is easier for you to stand on, and then just time you and how long it takes to drop. And once again, we're going to, the score's not on here, but it's on the sheet you'll get, of how long you're able to stand and in the age range that's kind of recommended. I think for those between 60 and 69 years of age, you should be able to stand 27 seconds on one leg. So we'll see. That's kind of the average. So used to, right. And that again is just more of just a kind of a balance, and you're at risk for falls. And so how are we going to do this? So obviously, like I said, today we're going to have you fill out the surveys and the assessments. We're going to hand those out in a few minutes and kind of have you each fill one of those out. And then we are going to measure you'll kind of keep your packet, which has the other forms in it with the standing and the walking test. And you'll kind of, Nancy and I will be in here to do your balance test, and then outside there we'll do your walking test. And we'll kind of keep the record. We can either keep it here, you're welcome to take it with you and bring it back, whatever is more comfortable for you. We do keep it confidential and secure. But if you want to bring it to your physician and be like, listen, I'm 15 seconds walking in my test to your doctor, you can tell them that, and it could give them some objective data to clue them that, hey, they're at risk for falls. I need to pay a little more attention to this. As again, we're going to send some of the unidentified data to Insignia just for part of a research study that we're trying to gather some data about, to find out just things that we can do as a support group to help you guys more. Nancy's going to go over, there's obviously a privacy policy and informed consent before you do any of this. It's kind of the legality of that, but some of you have filled it out before, but we actually have a new form, so that'll be included in the packet too. So what we're going to do is, I think Nancy's going to come up and explain the policy and the informed consent from Neuropathy Alliance, and then I can answer any questions you guys have, and we'll go around and hand out the questionnaires and surveys, and then afterwards too, I can hang out for as long as you need and answer any individual questions you have about this. Or yeah.